Good morning, everyone, and welcome to this webinar, Shoo the Taboo, Educating Your Children About Sexuality. I am Dr. Claire Pioquinta Doble, your moderator for today. For a better viewing experience, let me guide you through this Zoom webinar. You can click the view options on top, move your cursor over to Zoom ratio, click Fit to Window, check the side-by-side mode so you have a good view of the slides and speakers. Click the chat box for your questions, answers to questions, and your comments during the webinar. Should you wish to leave the webinar before it ends, click on the Leave button below. We are happy to announce that we will be now streaming live on the FB pages of the Medical City Institute of Pediatrics, the Center for Developmental Pediatrics and Feeding Clinic, and the Medical City. You may share this to your friends who cannot log in Zoom. The replay of this webinar will also be aired on our FB pages and YouTube channel. Welcome again to our webinar, Shoo the Taboo, Educating Your Children About Sexuality. Our webinar series is called Institute of Pediatrics Learning Academy's Coffee and Conversations. We hope to fill your morning with the gems to power up your Saturday morning. So grab a cup of coffee and just relax. Before we start our webinar, let us view this video from the Medical City Institute of Pediatrics. This webinar is brought to you by the Institute of Pediatrics Learning Academy. Watch out for this logo for our future webinars. It is a beautiful day. The sun is shining. No dark clouds in sight. I have my coffee, and now I am ready for our conversation. We are very lucky to have two esteemed speakers for today's webinar. To start, allow me to introduce our first speaker. She is an adolescent medicine specialist from the Medical City, the Philippine Children's Medical Center, and Manila Doctors Hospital. She is also the past center chief of the Division of Adolescent Medicine from the Philippine Children's Medical Center and a retired Professor 6 of Pediatrics, College of Medicine and UPPGH. Likewise, she is the past president of the Philippine Society of Adolescent Medicine Specialists, from 2012 to 2015, and the past president of the Society of Adolescent Medicine Specialists from 2002 to 2004. Let us all welcome Dr. Rosa Maria Nancho.
Good morning, Claire, and thank you.
Dr. Rosette, good morning. How are you doing today?
Good, and thank you for the bright, shiny morning to all. Thank you.
Yeah, that was really quite a week that we had during the bagyo, diba? Kamusta kayo, Doctor? I mean, I hope your family was safe and dry and well
Yes, thank you.
during the...
But let's pray for all those who are victims of this typhoon, and we look
Indeed.
forward to this good weekend discussion for all. Thank you.
Agreed, Doctora. Now, for our next speaker, she's actually one of the specialists that I message whenever I get cases of child abuse in the clinic. Buti na lang, konti lang naman sila because it can get really sad. So, our next speaker is a child protection specialist from the Medical City, Marikina Valley Medical Center, Valenzuela City Child Protection Center. She is also the chair of the Child Protection Committee of the Philippine Pediatric Society from 2020 until present. She is a board member for the Center for Prevention and Treatment of Child Sexual Abuse from 2020 till present. Likewise, a member of the International Society for the Prevention of Child Abuse and Neglect from 2021 until present, a consultant pediatrician from the Medical City, Birthright Lying in Clinic Cainta and Pasig Doctors Medical Center, and a clinical preceptor guest faculty from the Ateneo School of Medicine and Public Health. Please help me welcome Dr. Soydemer Claire Gresha.
Hello, good
Soy, good
morning, Claire.
morning.
Good morning,
Hi.
everyone po.
You have the
Hello.
same name. How are
Yes,
you? Do you have your coffee
I'm
ready?
good.
That's good.
Yes, I have my coffee here. Okay,
That's
so
good
let
to know.
me introduce po our moderator for today. She is a consultant pediatrician of the Medical City and Tri-City Medical Center, a medical specialist of the Mandaluyong Medical Center, and an auxiliary commander in the Philippine Coast Guard Auxiliary. So let us all welcome Dr. Claire Pio Quinto Doble. Good morning again, Doc Claire.
Morning. Thank you again. Daksai, thank you for that introduction. So sweet. Also, thank you to both of you for agreeing to be our resource speakers for today's coffee and conversation. I'm really glad to be a part of this webinar because this is an important topic and I know that we are going to have such an interesting discussion. And I genuinely hope our viewers will actively participate because we all know that talking about sexuality is a difficult conversation to have, di ba? Lalo na sa bansa natin since most of us are conservative and tend to avoid openly talking about these topics. Hindi ba, Doc Soy and Doc Rosette? What do you think? I mean, bakit kaya we tend to avoid these topics?
Well, for me, I think it's because we grew up in a very conservative society where, talking about sexuality and sex is quite taboo. And so that's why we are having this seminar, right?
That's true, ma'am. How about you, Doc Soy? Why do you think that is so?
I think mainly because we're a Catholic country. So yung mga expectations sa atin, di ba? So I guess that contributes to why we avoid to talk about these things.
That's actually a very good point. And maybe, yeah, that is so. So one of the things that we avoid talking about or mentioning even is the private part. Diba? Our private part. So I want to ask the audience. So let's warm you up a bit. What term do you use to call the private parts of your kids, of just the private parts? I would like to know your thoughts. Just type in your answers in the chat box. Don't worry, all your answers are correct. So I see here, I remember kasi kami, oh, so one said, Miss Lara says, vagina or penis. That's nice. Okay. Flower, pee-pee. Well, we all hear these things, actually. That's true. These are all very familiar words. So again, kaya we entitled this webinar today as such because it really is a taboo. Maybe it's in our culture, like what our speaker said, that we tend to keep quiet about these things. But whatever the reason may be, I know that this is a dialogue that we need to have. Because without open discussions, important issues remain hidden, diba? And as we will later find out, can have dire consequences. So having said all that, I would now like to invite our first speaker to start our conversation. Doc Soy, the floor is yours.
All right, let me just share my screen po. Okay. Ayan. So, okay, good morning everyone. Again, we'll be talking about sexuality education. So, ano po ba yon? So, sexuality education is a developmentally appropriate, culturally relevant approach to teaching about yung cognitive, emotional, social, interactive, and physical aspects of sexuality and not just the sexual act itself. So, hindi lang po ito tungkol sa pakikipagtalik. It also covers healthy sexual development, body image, intimacy, affection, interpersonal relationships, and gender identity. And we need to be equipped to teach our children about sexuality because, number one, karapatan po nilang maka-access ng appropriate health-related information tungkol dito. So, hindi po dapat sa TikTok or sa FB nakukuha ang mga kaalaman na ito. So, children also need to understand how to practice healthy sexual behaviors to reduce risk-taking, protect themselves from unwanted pregnancy and sexually transmitted infections, prevent abuse, and empower children to disclose incidents of abuse, avoid unhealthy and exploitative relationships later on, and learn how to respect others' right to body autonomy and other people regardless of their sexual orientation and gender identity. And also to protect our child's academic success. Syempre, mababawasan yung school absenteeism and dropout rates, for example, if ma-prevent yung teenage pregnancy. And also to promote an open, healthy communication between parents and their children. So, short question lang. So, saan po kaya galing ang kaalaman ng ating mga kabataan tungkol sa sex or sexuality? So, pwede nyo pong type yung mga answer sa chat box. Saan po kaya galing yung mga kaalaman ng ating mga kabataan ngayon tungkol sa sexuality? Okay, so yan, meron ako nakita sa kaibigan. Saan po kaya? Ayan, social media friends. So, compare po natin yung answers na ito sa survey, na national survey na ginawa noong 2021. So, sabi po sa national survey, pag tinanong daw yung mga kabataang Pilipino kung saan daw sila nakakakuha ng information regarding sa sex, pareho pong babae at lalaki ang nagsabi na wala daw po tayong formal material sources tungkol doon. Sunod na po nila na kinukuhanan ng information ay ang social media. At makikita po natin na pangatlo daw po lamang yung educational materials as sources of information. And then, kung tanungin daw po ang mga batang lalaki, kung kanino sila nagtatanong, kung meron silang mga questions about sex and sexuality, ang sabi nila, wala silang pinagtatanungan. Unang-una pala mga kaibigan, susunod, wala. 'Di ba? Tapos ang smaller proportion lang ng mga batang lalaki ay sa magulang nagtatanong at ang mga health professionals ang huling kinukonsulta. Pag sa mga kabataang babae naman, ang tinatanungan po nila ay kanilang mga nanay pa rin. Pagkatapos nun, wala. Pagkatapos nun ay mga friends naman at huli pa rin po ang mga health professionals na tinatanong tungkol sa mga questions on sexuality. And nung 2021, yung proportion daw po ng mga kabataan na napag-uusapan ang sexuality or sex sa bahay ay tumaas ng konti. Sa mga regions naman, ang highest proportion daw po ng mga kabataan na nag-uusap tungkol sa sexuality sa bahay ay nasa National Capital Region. At ang lowest daw po ay sa Davao at sa Caraga. So hindi pa po tayo nahuhuli dito sa Maynila. So, bakit nga po ba kailangan sa bahay nag-uumpisa yung sexuality education? Kasi marami pong nag-aaral pag-aaral na consistently nagsasabi na ang parents ay susi in shaping their children's views and attitudes on sexual behaviors and decision-making by sharing their own values, beliefs, and expectations. Yung pagiging involved daw din po ng magulang in sexual health education enhances communication and offers timely, skills-based learning. And unlike other sources, yung parents can provide continuous, personalized guidance tailored to their child's development. And this approach not only delivers accurate information but also reinforces safe practices katulad ng paggamit ng contraceptives. And ang strong parent-child relationship builds trust and making parents yung preferred and reliable sources ng mga bata tungkol sa sexual health education, especially po na meron talagang gaps sa mga school-based programs natin. And when parents set clear expectations around sexual health, mas sinusunod daw po ng mga bata yung mga guidelines na iyon pag parents ang nag-set. Then, next po, kailan po ba ang best time i-discuss itong sexuality education? So, sexuality education actually should start at birth. So, as sexual development begins in the womb and continues throughout life. And laying the groundwork is essential as children's understanding of related feelings and concepts develop from this stage. And then, timing is very crucial kasi sabi rin po sa pag-aaral na introducing these topics early fosters healthy development and gives children the tools they need to approach relationships and sexuality with confidence. And unfortunately, marami pong magulang ang iniiwasan po itong pag-uusap na ito or dinidelay po until meron ng tanong ang kanilang mga anak or kung meron ng boyfriend or girlfriend yung mga anak, doon pa lang mag-uumpisang pag-usapan. And mamimiss po yung mga key opportunities to set expectations and guide our children toward healthy decision-making. And effective communication about sexuality is most impactful before a young person becomes sexually active. Bakit daw po? Kasi it's easier to prevent or influence new behaviors than to change established ones. And by gradually introducing these topics as children grow, parents can prepare their children for the developmental changes that they will undergo. And starting early equips our children with the knowledge and values they need to make informed decisions about their relationships and sexual health throughout their lives. Then, paano naman daw po natin i-discuss yung sexuality education sa ating mga anak? So, parents should approach sexual health education as an ongoing conversation. Hindi lang po ito single talk na, ay okay, dalaga ka na or binata ka na or may ka-relationship ka na, mag-uusap na tayo tungkol dito. So, kailangan tuloy-tuloy po yun. And this encourages open, comfortable discussions about sex and relationships. And effective strategies include engaging in activities together. Kunwari, magbabasa kayo ng picture books together, using everyday moments as conversation starters, and building a close relationship, starting early, and creating regular opportunities for discussions are essential. And communicating with confidence and love, listening actively, asking questions, and remaining non-judgmental are important. Clear messages about parents' values and expectations further strengthen these conversations, helping children develop the knowledge and confidence to navigate their sexuality. Yeah. Doc Claire, I think
Doc Soy.
you have a question for me.
Yeah,
Yes.
actually, ang dami ko na natutunan sa inyo. Gitna pa lang ng lecture ninyo. So, at birth pala, dapat ang umpisa ng sexuality education. Like nyo, it's that early. I do have a question. You're right, I have a question. I'm sorry to interrupt, but obviously, iba-iba ang level of understanding ng mga bata per age group, diba? So, but how would you explain all these things, the sexuality education, to a 3-year-old as opposed to a 7-year-old?
Ayan, so pupunta po tayo sa developmentally appropriate approach sa sexuality education. So, sabi nga po natin, nurturing the biological and physical foundations of healthy intimacy begins in infancy. So, yung mga babies po, in-explore nila yung world nila through their 5 senses and begin discovering their bodies and by chance, yung kanilang ari. So, it's essential that babies feel valued and loved with cuddling and caressing to foster social and emotional growth. And since adults are responsible for protecting the baby, the caregiver should practice safe touches and use proper names for private parts to create a foundation of trust and safety. So yung sexuality education po at this stage focuses more on the parents kasi sila yung magsiset ng foundations and boundaries and encourage body positivity and respect for privacy. And it's important that both parents are actively involved in this process. So hindi lang po ito responsibility ni nanay. Si tatay po ay may importanteng role din sa pagsuporta at pagbigay ng gabay sa mga usaping ito. Consistent communication between parents build trust while modeling healthy relationships helps infants absorb positive behaviors and emotional cues. So, ito, katulad nito, di ba yung mga baby natin minsan pinanggigigilan yung ari, hinahalikan, kinikis-kis natin yung face natin doon sa ari or nirarub natin yung ari nila. So, do you think komportable sila noon kahit baby pa lang sila? So, you should keep that in mind. Okay, so during the toddler stage naman, children naturally become curious about their bodies, including their genitals and adult sexual organs. So it's common for them to explore through behaviors like masturbation, which parents can guide by teaching about privacy. So setting gentle limits po on activities such as public masturbation is essential, and this should be done without harsh reactions or shaming the child para makatulong po na maintindihan nila yung mga socially acceptable behaviors. So as toddlers grow, they also start to develop a sense of gender identity, recognizing themselves as male or female. And though this understanding can still change, so hindi pa yon fixed. And then transient cross-dressing is common at this stage and is part of playful exploration. Parental acceptance of a child's identity is crucial for their mental health and adjustment. And parents should offer clear, non-judgmental guidance and use, correct terms for private parts and everyday moments like bath time or dressing can provide opportunities to introduce these names. So again, using euphemisms po or made-up names for body parts such as bird, flower, snake, etc. may give the idea that there is something bad and shameful about these terms. So it's important po to explain to your child which parts are private. So yun po yung natatakman ng bathing suit sa breast at sa bandang ari at puwet. Okay, so it's also imperative to start teaching our children about personal boundaries and consent, emphasizing that their bodies belong to them. So, pwede pong may teachable moments during bathing or dressing and sasabihin natin, did you know that your body belongs to you? And because it belongs to you, you have the right to decide what happens to it. So, yung mga rules na po na yun ay tinatawag na body boundaries or personal safety or the touching rule. So, wala pong dapat magtingin, humawak, pag-usapan or picturean ang private parts ng mga bata. And yung only time lang po na pwedeng tingnan ang private parts ay kung ito ay for hygiene and health purposes. So, ulitin po, for hygiene and health purposes lang. So, pag nililinis ni mami yung ari ng baby or ng bata, or pag sine-check up ng doktor. At hindi po yung doktor-doktoran, yung totoo pong doktor yun, ha? Okay. So, for preschoolers, yung sexual development naman po is marked by modesty. So, interest in reproduction and learning concepts of right and wrong. So this is the age for toilet training, teaching body hygiene, and reinforcing body safety. So children may ask questions about where do babies come from? So it's important to provide simple age-appropriate answers without embarrassing them. For instance, you could ask the child, what do you think? To gauge what they already know. And a simple explanation like, babies grow in a safe place inside their mother called the uterus. So as simple as that is often sufficient. So if you're pregnant or may mga relatives or neighbors na pregnant, pwedeng tanungin ng bata, where does the baby come out? So pwede nating sabihin na when your little sister or brother is finished growing, she or he will come out through a part called the vagina. So simple as that. So at this stage, children also become aware of the social norms, engaged in cooperative play, and begin to form same-sex peer groups. So to promote healthy sexual development, it's essential to teach body safety, including the use of proper names for genitals and understanding safe, unsafe, and unwanted touches. Di ba? So, gaya po ng sabi natin, nagbibuild lang po yung mga pinag-uusapan from yung infancy until yung preschool and later on then sa later stages. So it's important to recognize that whether a touch feels safe, unsafe, or confusing depends on how the child experiences it and not the intention of the person giving the touch. So tandaan po natin yun ha. Ang isang adult, pwedeng ang intention niya ay dun sa touch ay mag-show ng support or attention sa bata. Pero kung ang perception ng bata ay hindi yun confusing yun sa kanya or hindi siya komportable, mas importante po yung nararamdaman ng bata. So the adult's intentions are irrelevant in determining how the child feels. So pag-usapan po natin, safe touches. Safe touches po are those that are good for the body and make children feel cared for and loved, such as hugs, pats on the back, or even an injection from a doctor. So kailangan natin i-explain na kahit masakit po yung injection, pero importante yun to keep them healthy. Kaya safe touch yun. So even if it hurts. Safe touches are perceived as warm, caring, nurturing, supportive, and without diminishing the child. And paano naman po yung unsafe touches? Yung unsafe touches, on the other hand, hurt the body or feelings, making children feel sad, scared, or angry, such as, kunwari, hitting or touching the private parts. They are perceived as hurtful, causing pain, disregarding the child's feelings, and experienced as manipulative, coercive, abusive, and frightening. So we have to teach children that these kinds of touches are not okay. And sometimes children may feel confused. So confusing touches naman, for example, a hug from a relative might start out as safe, but later on hindi na sila komportable if it lasts too long and they can't breathe. So pwede kasing isipin ng mga bata, kung love ako ng relative ko, bakit ganito yung ginagawa niya, hindi na ako makahinga. So this confusion makes the touch feel unsafe. Children should understand that some touches, while safe, may not be wanted. And it's okay to say no. Then children should know they have control over their bodies and can say no to unwanted touches, even from family members or relatives. So tandaan po ha, pwede pong magsabi ang no ang mga bata kahit na yon sa mga loved ones nila. This empowers our children to set boundaries and feel comfortable refusing any touch that makes them uneasy. And importante po sa age group na to na maturuan po sila nung 3 safety steps. Say no, get away, and tell a trusted adult. So we have to encourage them to practice assertively saying, stop that, or I don't like that. So pinapractice po yun ha, dapat with confidence and with a firm voice na masasabi nila iyon. Tapos, emphasize natin the importance of leaving the situation immediately and telling a trusted adult, continuing to seek help until someone listens to them. So, explain that getting away can be as simple as leaving the room, leaving someone's lap, kasi di ba tayong mga Pilipino parang mahilig tayong magpakandong, or running to safety when needed. So, yun po. Importante yun ha. 3 safety steps, say no, get away, and tell a trusted adult. And then, we have to also teach our children that secrets about touching are never safe. Pwede natin explain sa kanila yung difference between surprises, which are good, kunwari yung mga birthday surprises, and unsafe secrets. Yung unsafe secrets, hindi yun pwedeng itago, especially if someone breaks a touching rule. So we have to reassure them that they can always talk to us, parents, about anything. And it's never too late to discuss a touching problem. Kahit last year pa po nangyari yung insidente or years ago pa, kung ngayon lang po nagsabi sa inyo ang mga bata, okay lang po yun ha, hindi natin sila pwedeng i-blame. At hindi rin natin pwede silang sisihin na kasi ang ikli mo mag-shorts, ganyan. Na pag may nag-violate ng touching rule, hindi po nila yun kasalanan. So, bawal ang secrets. And we have to help them identify po yung safety circle nila. 3 to 5 trusted adults po yon within and outside the family na pwedeng lapitan ng mga bata pag may nag-violate ng touching rule. And we have to make sure that na intindihan ng mga bata at yung mga safety circle natin na adults na ready dapat itong mga tao na ito na maniwala, sumuporta at tumulong sa kanila no matter how difficult or scary the situation may be. And we have to reinforce that they should keep telling a trusted adult until someone listens and provides help. So, hindi po dapat titigil ang mga bata humingi ng tulong hanggat hindi sila pinapakinggan at hindi nabibigay yung tulong na kailangan nila. And lastly, we have to limit the media exposure po to age-appropriate content kasi mas importante yon to prevent undesirable sexual references and languages na makikita po natin all over the media, sa TV. So, that's about it. If you have questions po, I will answer them later. Just type them in the chat box sa open forum po ko sasagutin yun. Okay, Doc Claire?
Doc Soy, thank you so much for such an insightful lecture. Okay, so that was Doc Soy who talked about sexuality education on infancy and early school age. Now let's welcome Dr. Rosette Nanshaw to discuss sexuality education on tweeners and teens naman.
Yes, good morning to everyone. And again, thank you, Soy and Claire, for this. We will now tackle the school age, no? So yung medyo post, mga medyo older school children, and maybe the tweeners and the early teens for this lecture. So let's go. So we have heard what sexuality education really starts at birth. And it's really important for us to understand that there are really important things that we have to discuss, like, for example, the physical, emotional, and social changes in this age group, the common questions or misconceptions of parents, how to establish confidence in handling sensitive topics to our kids, trying to normalize the child's curiosity about sexuality and relationships, and helping build that communication and how to communicate family values. Let's go. So for this age group, actually, the teens, we have to talk about what is happening to our bodies. Can we have the next slide? So for the for the school age group, no, we have this period when they start becoming sensitive, no, to their bodies. And during the tweeners, you know, the tweeners is a newly coined word, yung parang in between the late school age and the early tweens. So this is the time that they start becoming rebellious, trying to bend rules, you know, expressing their independence, trying to be curious about what's happening to their bodies and very conscious about their body weights, how to fit in with their peers, no? Kasi sila na yung parang importante sa buhay ng mga batang ito. That's next slide. So, next slide, please. So this is the age when, you know, the period of adolescence, the world has says we have to understand them in the period that they are in. Hindi yung dati natin na kasanayan natin when we were young, ganun din sila. We have to understand them, and we have to show them that these are the periods when the changes in their bodies can affect not only the psychological, but even the social and emotional aspects of their development. And likewise, these psychological and emotional aspects can also influence the development of their own bodies. Next slide. So, can we have the next slide, Soy? Yes. So these physical changes, no, that happen to these teens already, no, so they become curious, no, about what is happening to their, you know, why they're having this kind of maasim na smell, or sometimes the changes in their bodies, no. Sometimes the boys, no, they feel that they have already breast budding also. Ano ba ito, no, na nagiging babae na ba sila, no? Bakit sila may konting boobs din or nipples, no? So we have to tell them that this is expected sometimes in certain boys, that they grow some breast budding, no? But they have to develop also their muscles, no? And so all these body changes can also affect them emotionally, so they can be very sensitive, no? They start looking to who they are, what they want to be, no? So there's a lot of uncertainty in their sexual feelings, no? Bakit ganito ang surge ng emotions nila, no? So how can I conform to the peers, no? Minsan natutukso ba sila or kailangan ba gaya-gaya sila dun sa kanilang mga peers, no? So they have to understand ano ba ito mga na feelings na nangyayari sa akin, yung emotions. I'm having crushes, no? Maaga sila ngayon nagkakaroon na ng crush, no? Lahat itong emotional changes nakakaabala sa kanila, no? Na nagkakaroon sila ng feelings of uncertainty. So next slide. So when you see, next slide, please. So you can see how all of this can really affect their emotions, no? Next slide. So remember, while many teens wish that they could talk to their parents about sex, many feel uncomfortable, no? And so what are these steps that we have to take? First of all, you have to find out what your children already know. Oh, what do you know about puberty? Ano ba yung physical changes na alam mo nang nangyayari sa mga classmates mo o sa sarili mo? Nakikita mo ba? Ano sinasabi ng mga iba tungkol dito? So you know, you can express this, and then they're having wet dreams. No, don't worry. These are things that can happen even to girls, no? So you have to explain this and give them factual information at wag papahiyain sila about it, no? And then this is the time also that you can infuse your own values about respect and things like that. Next slide. So you can see, no, sometimes they are very concerning, no? Sometimes it was mentioned masturbation. If this persists, even you know, even if someone has tried to get them to do something else, no, then these are wrong already, no? So if they do it in public, if it interferes with their activities, so ang concentration nila yung sarili nila, and you can catch them sometimes in their room or in their CR doing this, no? If it interferes already, lagi silang nag-iisa na lang, no? And sometimes you can see that their genitals humahapdi or things like that, then these are quite concerning. Next slide. But there are more harmful sexual behavior also in children, no? Pag bastos na masyado yung mga salita nila, minsan nakikita nila yan sa mga videos, sa mga YouTube or yung mga TikTok, or sometimes they're playing games with sexual themes, no? They start doing the act, and yung nag-open mouth kissing na nakikita nila sa mga movies dyan, ano? Or persistently touching their genitals or the genitals of other children, or sometimes playing with animals and touching the genitals of animals, no? So parang nagbabahay-bahayan sila, and sometimes they start inserting little toys into their vagina or in their anus, no? So these things, of course, are harmful sexual behaviors, and they have to be corrected. Can we have the next slide? So forcing other children to take part in sexual behaviors like oral sex, no, or penetration with objects, of course, this is wrong, no. So watching for pornography, no, we have to really correct. That's why you have to guard and put safeguards in their internet, no. And taking photos, no, of their own parts or other children's parts. Again, you have to emphasize that these are wrong, not acceptable behavior. Next slide. So why are children not trying to engage in this? Sometimes, no, when they are exposed to porno and other sexual activities, or they're experiencing already child sexual abuse, as has been emphasized in the early lecture, or you're having hard time to manage their emotions, then it's probably time to seek help from your professional experts, no, and refer them to a child abuse protection unit, or talk about it to your doctors, how to handle these emotions. Then I think this is a really time, no? So how do we respond to sexual behavior in children, no? First, ask your children what already they have. Do they have questions about sex, sexual affection, their own identity? Give them factual information about the physical changes, and talk appropriate behavior. When is it acceptable, when it is not, using the correct parts, reading books with them. I like this, no? Kasi reading books and viewing videos together. So if you cannot answer it right, no, sabihin mo, let's look at it together. Let's read about it, or let's watch about it, so I can also learn, no, and explain it to you. So these are some tricks, no? So it's also important to emphasize the healthy lifestyle changes that they need. Okay, and then of course, there are myths, no? Puberty myths, no? Sometimes sabihin nila, ma, nagkakatakot, ano ba itong nangyayari sa akin, no? So we have to emphasize, that's why important ang early sexual education, no? Kasi minsan nabibigla sila, no? Hindi sila pala prepared, hindi naman sinabi sila sa kanila sa school. So, or tinuro sa school, pero pag sarili na nila, parang natatakot sila, no? So kailangan natin i-explain na these are part of normal development, no? So sometimes kids say, ma, ayoko nang makinig sa iyo, no? Natututunan ko naman yun sa school. So you just give them some free space, no? But use also golden moments to teach these children. Next slide. So important din na binibuild natin yung self-esteem at respect ng kanilang body, no? So you have to teach your children how to resist, no? To conform lagi, no? Nakikita nila yung mga idols nila, ganito ang itsura, ganito ang itsura. So parang nakikita nila na kailangan gayahin. Sure, no? Pero kung nagiging harmful na sa kanila yung behavior at saka sobrang consumed na sila sa kanilang mga body changes and that they really have to conform, sabihin ninyo na sometimes it's not anymore encouraging, no, to do it, no? So they have to learn how to see that not everything has to be conformed with what they see on media, no? So my question to you as the audience is, how do we, what are the circumstances that affect the child's self-esteem? Can you type it in the chat box, no? Ano ba yung positive changes na nakaka-affect sa self-esteem nila, or sometimes negatively? Ano ba yung mga negative circumstances na nakikita ninyo na sometimes natatakot sila, no, or na-affect sila, so nagtatago na lang sila, ayaw na lang makibagay, no? So ano kaya yun? Can you type it on the chat box? So makikita ho ninyo dito, no, na sometimes yung body odor nakaka-affect talaga, no? Minsan ayaw na nila makibagay, so kailangan i-correct natin yun. Ano ba yung pwede? Unang-una, dapat naliligo regularly or araw-araw. Yung pimples, talagang nakakaano yun, ano, nakakaya. Minsan titirisin na lang nila kasi nahihiya sila, so lalong nagkakaroon ng scarring. So kailangan talaga matugunan natin yung mga ganong concerns. Or minsan yung teeth nila, no, nagpo-protrude or absent or ano, nakakahiya talaga yun. So kailangan talaga makita natin na merong mga little things, no, body changes sa kanilang katawan na talagang nakaka-apekto sa kanila. Dapat natin ibigyan ng answer or help them, no, bring to the dentist, or talagang yung mga gaining obesity, o yung mga tumataba ngayon dahil ang hilig lang kumain, no? So kailangan din ng self-control. At saka bad breath, no, talagang kailangan talaga nila, no, na mag-gargle, regular teeth care, no, how to eat properly, no. So itong mga little things ganito kailangan talaga makaka-affect talaga sa kanilang self-esteem. So importanteng mabigyan natin ng good advice on this, no. Next slide. So, ang isa pa nating concern, no, is how to do this, no? First is you have to teach them how to be kind to themselves, respect themselves, no? Importanteng mahalin nila sarili nila bago matutong magmahal ng ibang mga peers or our friends, no? So kailangan mahalin muna nila, respetuhin nila sarili nila. Focus on the positive. So kung anong kakayanan nila, no? They have to go out and discover their talents. Kailangan makita nila kung ano yung kanilang kakayanan, no? Para nag-i-improve talaga yung self-esteem. Kaya gustong-gusto ko yung ine-encourage natin ng mga bata na mag-join ng mga sports, mag-volunteer sa mga charitable institutions, sa simbahan ninyo, no, sa group ninyo, na nakikita mo nagde-develop ang personality niya at lumalabas sila. Hindi yung lagi nakatago sa loob ng kanilang mga kwarto, nandun lang sa internet at kung sino-sino ang nakikita nila doon, no? So importante talaga, you have to guide them, no, to be more assertive. So next slide. There are also other things that you need to know. You have to engage, no, these children to do things that they enjoy, no? So mga sports, kung ano, mga talent, no? And then teach them already to be responsible, no? So make them really do things in the house, no? Teach them how to clean, clean the house, clean the car, no? Ito mga ito, kailangan lalabas na sila at magtulong sa kanilang mga magulang, umpisa sa bahay, tapos sa school, tapos sa community. No? Kailangan lahat ito tina-try nila. So, there are also others, no, so that you can build the self-esteem and discuss these sensitive issues to your teens and tweens. Next slide. So you have to equip them, no, with accurate information. No? So it's important that you give them that opportunity to express, no, yung mga questions nila tungkol sa sexuality nila. No? So hindi pwedeng yung kaagad nagfe-flare up ka, no, na rinig mo sila, meron silang questions about sexuality, biglang ang tinig-tinig na ng boses mo. No? Stay calm. No? Avoid overreacting. No? Remember that it is important that you engage them in a comfortable environment, safe environment sa kanila, para hindi sila yung natatakot sa inyo magtanong tungkol sa sexuality. Ang pinaka-importante talaga, kayo, kasi kayo ang magtuturo ng mga importanteng values sa kanila. No? Next slide. Likewise, it is also important to be open about your own values. No? So meron mga resources na magaganda, and I have shown here, no, in your slide, itong mga good sources na pwede ninyong pakinggan sa sarili nyo, pero magandang makita din ng mga bata. So engage them, pag-usapan ninyo habang pinapanood ninyo itong mga sa YouTube, at magandang opportunity ito para matuto kayo at matuto din yung mga bata. Next slide. So it's important, no, to teach your children values, no? So ano pa itong mga values na importante? Number one, respect. As I told you, they have to know how to establish crucial relationships, no, with people, and then learning what boundaries, how to respect their own boundaries, and when yung mga boundaries ng mga tao, pag sinabi ng mga na ayaw nila, respeto, no? Hindi pwedeng pilit sa iba, no? Kung ano yung nakikita mo, gagawin mo din sa iba, no? It's important also to emphasize mutual consent in any relationship. So kung ayaw pa ng girl, hindi pa siya ready, okay lang, no? Kasi talagang gano'n. So dapat yan na pag-uusapan ng magulang sa mga bata, no? And then of course, honesty and communication, learning how to express your feelings at the right time, no? And what are the intentions of expressing that kind of feeling, no? It's also important. You should also learn how to value, no? They should learn also, next slide, to be aware, no? Ano ba yung worth mo as a person? Ano ba yung importante sa iyo, no? They should not feel pressured, no, to engage into sexual activities just because sinabi ng kabila na pwede sila, no? So kailangan natututas sila magsabi na no, no? So importante yung learning how to trust muna, respeto, understanding, care, and learn to be patient. No, importante yung patience, no? Hindi yung nagmamadali dahil ginagawa na ng iba, gagawin mo din, no? Kailangan ready, no? Genuinely ready. Next slide. Also, protection. We have already spoken that a lot, no? How to avoid abusive relationships. And of course, bringing yourself, no, to that dignity and privacy that you really want, no? So you have to, they have to learn how to avoid, no, when somebody is violating your privacy. Next slide. So for parents, teach your parents, no, teaching your teens to make informed, thoughtful decisions about their sexuality is very important. Help them foster a foundation for healthy relationships throughout their lives. Okay? And of course, as parents, you should understand the core principles of unconditional love. No? So that love that extends from you to them, and whether they are, misbehaving or, having thoughtless expressions, unconditional love is very important. No? Of course, it is important, no, that these teens meet their parents, but it's not only academic achievement or very performing always very high. No, what is more important is being fair, generous, no, kind, respectable human beings, no? Rather than achievements lang ang nakikita natin sa mga bata. So teens watch what we do more than listen to what we say. So role modeling, okay? That is the key. So kung anong behavior mo, nakikita mo, makikita din nila yan. So they will learn from you talaga. Next slide. So again, it is very important for us to remember that there are body changes, there are different feelings that these children are now developing. So it is rather important that you become non-judgmental and talk freely about healthy sexual relationships and behavior. For that, thank you all.
Wow, thank you, Dr. Seth. That was very eye-opening. Now, I'd like to welcome back Dr. Soy. Doc Soy, hi, because it's time for our open forum. So if you have any questions to our audience in Facebook Live, in Zoom, feel free to type in your question. Actually, meron na pong phone-in question. Meron ng, may nagtanong na ng maaga. So I think this is for Dr. Nancho. Dr. Rosette, you already have a question. So someone asked, how can we talk to our teenager about sexuality in a way that is open, respectful, and aligns with our family values without making them feel uncomfortable or judged? Hirap naman ng tanong, Doc Rosette, this is really for you.
Yeah, I think first of all is really very important is to create a safe environment. No, pag sinabi mo safe environment, an environment where it's they don't feel that they are judged, they don't feel that they will be embarrassed or criticized or dehumanized, no, in expressing their own thoughts. That's number one, no, a safe environment. And then of course, as we said, an honest conversation with our teens, no? So pag mayroon na kayo nakikitang concerning behavior or mga questions nila or yung behavior nila na medyo unusual na sa kanila, important na maging straightforward yung language ninyo, no? And try to listen more than speak, no? No? Pakinggan niyo sila, no? Hayaan niyo sila mag-express ng kanilang questions and then pakinggan muna ninyo. So it's very important na hindi tayo judgmental, no? And of course, try to normalize always your conversation with your kids. Hindi yung parang masyado niya, ay, halika dito. No? Halika, pag-usapan na muna natin yung mga ganun. Parang lalong nahihiya sila or natatameme sa inyo. So important.
Absolutely.
Uh-oh.
Thank you for that, Rosette. We have another question. What are some healthy ways to guide our adolescent in navigating peer pressure and relationships, especially when it comes to making safe and informed decisions about sex? Another very interesting question.
Yeah, grabe talaga ang peer pressure kasi nakikibagay talaga sila at hindi nila alam kung kailan talaga sila mag-iiwas kung mali na, no? Kaya nga importante talaga sa atin talaga manggaling, no? Na matuto sila ano yung mga safe spaces, paano magsabi ng no na pag feel uncomfortable na sila. Sinabi ito ni Dr. Soy kanina, no? Na kailangan marunong na sila kung yung ano yung boundaries sila, no? Para hindi sila biglang nahiya o natatakot kaya go along na lang sila. Kailangan talagang intindihin nila na i-demand nila yung respeto ng iba sa iyo. Ganun din ang gusto mong itrato mo sila, di ba? So teach them how to respect their own boundaries and the boundaries of others. Para kahit na ma-reject sila kung ayaw, malaman nila kung sino yung tamang kaibigan at mga hindi kaibigan at saka yung mga kaibigan na tutulong din sa kanila, no? Yung mga kaya kailangan nakikibagay sila. So meron mga kaibigan na let go na lang or hi hello lang na friends. Pero meron din friends na talagang gusto mo kasi pareho ang values mo sa kanila. Importante ina-emphasize yun. Thank you.
Thanks, Dr. Seth. So for Doc Soy naman, I actually have these questions from parents. They always ask, Doc, paano ko ba sasagutin yung Mommy, where do babies come from? So how do you answer these questions? I feel like it's, the stork dropped you sa windows, diba?
Oo.
Parang that's the
So,
usual answer.
I think may practice na tayo kanina, di ba? So, pagka ni-ask tayo ng mga anak natin tungkol doon, just be factual about it. Like, for example, ask them muna, ano kaya sa tingin mo, saan kaya galing? Para mag-gauge natin kung ano na yung alam nila at kung paano ba bigla nilang naisip yung mga questions na yun. But, ayun nga, pwede natin sabihin as simple as, where do babies come from is when mommies and daddies love each other, yun, merong babing nabubuo. That's for adults na ginagawa. And also, sasabihin natin na yung baby nag-grow sa inside the part ni mommy sa tummy niya na ang tawag ay uterus. So, pwedeng ganun. So,
Okay,
yun
thank
po.
you. May isa pa tayong question sa Zoom, ma'am. How do we deal with high school kids studying in all-girls school who get attracted with the same sex? Tara Nansha, I think this one's for you.
Yeah. Sometimes this feeling is normal during this age group, no? So dapat naintindihan ng mga magulang na minsan na-attract sila sa same sex kasi this is the normal phase. So sa early age, no, ng mga teenagers, talagang minsan akala nila may crush na sila sa kanilang same sex, gano'n. So you have to explain to them, no, na pwedeng na-attract ka ngayon pero magbabago yan. Kaya importanteng nakikilala mo din yung mga ibang friends at payagan ninyo din sila mag-soiree, no? Minsan mga soiree, mga third, fourth year, no? So inaalaw na nila yan. Or sa mga school fairs, no? Meron din mga boys na pumapasok sa mga school fairs. So ganun talaga. Kailangan sabihin mo sa mga anak niyo na nag-iiba naman ito. Siguro later on, baka pag nakakita ka na ng boy na cute dyan, magkaroon ka din ng crush doon, di ba? So, okay lang yon, ano? So, huwag masyadong matakot ka agad kasi normal phase na medyo attracted muna sila sa mga girls hanggang nakikita nila towards the middle and late adolescence na naiiba din pala yon.
Of that. Thank you, Dr. Rosette. That question was from Ma'am Michelle Skia, by the way. And we have a comment. Ma'am Eliza Raho. She said that when I was pregnant, my then 4-year-old child asked me, "How does the baby grow in mommy's belly?" I told her that babies start very small and slowly grow. Then she asked, "Who put the baby in there?" And I told her that Mama and Papa put the baby there. Then she asked, "How did you put it in there?" I told her that that was a very good question and that I need time to think about an answer. So, yun, Daksay. I think this was the
Ayun.
question earlier, but very good si
Oo.
Mommy Eliza
Very
Rao.
good si Mami. Ayan.
Nag-isip
Pagka
muna
po
because,
hindi, yes, pag hindi po natin alam or parang syempre practice din po sa atin yun eh. If hindi pa po tayo ready yung magsabi ng answers, pwede po, tama po yung sabi ni Mommy, pwedeng ganun yung answer. But of course, kailangan natin sila babalikan. 'Di ba? So kailangan, okay, yung katulad na sabi ni Doc Rosette kanina, okay, let's watch yung movie together, ay yung parang educational videos or read books together. Kasi meron na pong rin mga books tungkol doon. Of course, dapat age appropriate yon. But of course, different pag ang nagtanong niyaan ay 9 years old since inaaral na nila yun sa school. So, pwede may nang sabihin na yung about sperm and egg cells kasi inaaral na nila yun sa science. So, hindi natin pwedeng i-dump down yung nalalaman nila. So, pwedeng itanong natin, ano bang alam mo na sa school? So, kailangan natin mag-gauge kung ano na yung alam nila. And then, if hindi natin alam, we have to answer nga na, okay, let's find out together para matuto din ako. So, ganun.
That's true. That's true. Okay. Next, Doksay. Another question from Christine Lapus is, good morning po. Would like to ask, how do we answer our children asking how babies are made? My daughter is 9 years old. So, ito pala nasagot na siya. Merong nag-private message sa akin kasi nahihiya siya sa question or nahihiya siya message directly sa chat group. But she asked, is it better to teach the adolescents about sex avoidance until a certain age or educate them more about safe sex, such as using condoms? That's a very good question. Who would like to answer that?
Yeah. Well, I think early education starts with talagang even as early as school age, no, but you have to talk about safe sex also, no, and that's why it's not endorsing condom use, no? Because sometimes what their tendency is, kung may condom, they will start using it, no? But learning how to respect boundaries, no? And then that there is a right time. And then tandaan din ninyo na ang condom pumuputok, so pwedeng makabuntis, no? So you have to tell these things to the teenager already, no? Na there is a good time, and try to respect the boundaries and the boundaries of your friends, no? Para hindi gano'n na nagre-risk-taking behavior na sila, no, to the point na magkaroon na sila ng problems later on. So, sexually transmitted infections. So, sasabihin nyo talaga ito sa mga bata na nakakaintindi niya naman sila mga teenagers.
Mukhang mahaba-habang conversation yan, Doc
Oh.
Rosetta, no? We have another question. In your practice, is there a threshold you see for when parents feel the need to seek professional help when they can't communicate well with their children? That's from Mr. Leo. Who would like to answer that question?
Okay, I would like to answer that. Thank you po, sir, for the question. So sa amin, sir, of course, may limit lang tayo, di ba, as parents na what can we get from yung internet. Although maraming sources na po na nandun. So we have to empower ourselves also. Kung pwede nga lang pong may parenting academy, kasi ang hirap po talaga, di ba? Sana tinuturo din to sa bago tayong magka-baby. Pero kung kunwari, anytime po na feeling nyo hindi nyo na naibibigay yung what your child needs regarding yung mga usapin na ganito, huwag po kayong mahihiyang mag-ask ng help from your healthcare professionals. And of course, dapat yung healthcare professional na yun, dapat trusted nyo din na yung mga pediatricians natin from yung simula baby pa sila. Kasi mas kilala na sila nung bata mas mapag-uusapan po yung mga ganitong usapin. Tapos pagka teenagers naman, syempre pwede tayong mag-seek ng help sa ating mga adolescent medicine specialists like Dr. Rosel.
Would you like to add to that, Ma'am Rosette?
Well, yes, I think it's about time that we talk about this and become more comfortable with it. So if you really are not comfortable in talking about sexuality, you can always reach out to us, no? And we can probably help you and your kid. Like for example, no, itong question na isa, no, yung Sanya na may ADHD na, no? Ano ba, mas okay ba na ang daddy na ang makipag-usap? Oo. I think mga pag dumadating na sa mga behaviors ng mga boys na nagkakaroon na sila ng mga unusual behaviors and talking about intercourse already, maganda din na meron ding role ang papa or ang daddy diyan, na 11 years old na siya, may konting ADHD, kailangan talaga ang daddy is there to guide the boy, no?
Very good point. So, thank you, Doc Rosette and Doc Soy. Again, we still have questions. If you're still up for it. We have another question. What process do parents need to follow when their child has been a victim of abuse? I think, Doc Soy, this one is for you.
Oh, okay. So, pag victims of abuse, so syempre, hindi po natin kailangan i-prove yun. Unang-una, pag may disclosure ang bata, kailangan unang gagawin, paniwalaan po. Kasi hindi po sila nag-iimbento ng mga ganong disclosures tungkol sa abuse because paano po nila yun malalaman, di ba? So, either na-experience sila or na-expose sila. Both ways, they were abused kahit exposure lang yun. Pangalawa, we have to remain calm. So, hindi pwedeng, ay, naku, ang anak ko, or magagalit ka, or bigla ka nalang iiyak kasi bigla silang magsha-shutdown. Hindi na po yan magiging open sa inyo. So, okay, hinga ka lang. Kung gusto mong umiyak, time out ka muna. But you have to remain calm talaga when talking to your child about it. And then you have to affirm the child's feelings. Yung, okay, I understand, and you're very brave na sinabi mo sa akin to. And then next, you have to tell the child what will happen next. So, ang gagawin natin, since importante ka, we have to seek professional help. But, we have to ask their permission. Sabi mo, okay lang ba yun? Kasi importante ka kailangan natin ng tulong kasi hindi kaya ni mommy or ni daddy na kami lang tutulong sa iyo. And then next, yun nga, support the child. And lastly, very important, we have to report the abuse. Sabi ko nga, hindi kailangan na evidence. May evidence, hindi rin kailangan na sure kayo. Kahit na suspicion lang po. So, we have to report po yung abuse para ma-protect po yung child. Yun po yung kailangan natin gawin.
Thank you so much, Doc. Ang daming questions actually. So we still have, from Miss Rika P, my 2-year-old girl turning three this November keeps on touching her vagina playfully when she's naked and about to take a bath. How do I talk to her about it?
Ayan, so nabanggit po natin kanina, di ba, common po sa ganitong age group yung pag-explore ng kanilang bodies, pati yung private parts and including yung masturbation. Hindi po yon uncommon for this age group. Pero you have to set limits lang pag public na yon. Kung private naman sa ano siya, si bath time, and then pwede natin siya i-distract na, kunwari, give toys, di ba, i-divert yung kanyang attention away from what she's doing. Pwede pong ganon yung gagawin natin. Yun po yung pwedeng gagawin. So, kailangan lang i-remind na hindi siya pwede sa public. And yun nga, if we want yung behavior to stop, pwede natin siyang i-divert yung attention and not yung overreact pag nakikita natin na ginagawa niya yun. Yun.
Thanks, Doc. Sorry. Alam mo, ang daming nga concerns na ganon in the clinic also. So, do we still have any more questions? Yes, Doc
I
Sai.
think we want to share po sa inyo yung reference book. So pwedeng mag-start sa mga bata. Ito po, mura lang to. Sa Lampara Books, sa National Bookstore meron, sa Shopee meron din po. Hindi ako ano to, ano po, sexuality education. So, pag meron kayong anak na under 5, pwede po itong basahin sa kanila. So, hindi lang kasi tungkol dun sa pagtawag ng private parts, which is very important, but also they teach us also yung hygiene. So, personal hygiene. Ayan, thank you po.
Okay, thank you. Do we have, I'm just going to check. Okay. May pahabol. What can we do? This is from us, Miss Marie Lucille. What can we do if there's a denial from the parent guardian when a child or adolescent has experienced abuse or you have suspicions? Very hard.
Doc Rosette, do you want to answer? Or
Yeah.
ako po?
Kaya, pag may mga ganito, it's very important, no? So, ikaw bilang isang, kunyari, kaibigan mo yon, no? Ang parent na yon, pero sobrang denial siya. Kailangan talaga pag-usapan mo ng one-on-one closely, no? And then assure them that it is safe, that there are people that they can reach out to talk about it. And then ask if it's okay that you samahan mo sila, no? Doon sa child protection or women's abuse center para meron siyang kasama para lumakas ang loob niya. For me, that's really very important, no, na kausapin mo yung at encourage mo yung parents kasi minsan sobrang denial din ng mga ito, no? So kailangan meron tutulog talaga sa kanila. And then when they reach the pediatrician, yung pediatrician naman ay magre-reach out tsaka magwa-one-on-one muna, kakausapin yung magulang para nakikita din ng magulang bakit importante na matugunan itong problema ng mas maaga kisa later. Thank you.
Doc Sai, would you like to answer also?
Yes, opo. So, thank you for that question, no? Importante po, hindi po siya uncommon. Actually, marami pong magulang na in denial. Especially po, yung nakikita namin sa Child Protection Unit, mga fathers, stepfathers, yung mga perpetrator. And usually in denial si mother na kaya nagtuloy-tuloy yung abuse kasi sinabi na nung bata sa kanila before, kaya lang hindi nila pinaniniwalaan, kaya nagtuloy-tuloy siya. We have to remember na kahit suspicion lang yun, we need to protect our children. And if kung ano man, sana maisip natin lagi yung best interest ng child. So ano ba ang mas makakabuti sa kanila? Yun po yung lagi sana nating maiisip para importante mo-protection na natin yung ating mga anak.
Okay, thank you, Doc Sai and Doc Rosette. Those are ang daming questions, ang dami nating natutunan today. But unfortunately, that is all the time that we have left for questions. Doc Soy, Doc Rosette, may I ask you for any parting words for our audience?
So I'll go first, no? Remember, it is very important, no, for parents to educate our kids early. No, it is necessary that we grab those golden moments, no, in those opportunities, and discuss it developmentally appropriately ways, no? So to teach sexuality to our kids, always give them or create a safe space, be good role models to your children, and talk about sexuality in a way that they can appreciate that it is a gift from God, no, to us as humans, something that to be respected, where we can teach and respect boundaries, no? And important talaga yung preparedness natin sa sarili natin, no? And teach them how to be prepared that there is a right time for the right partner or right person. That's it. Thank you.
Thank you, ma'am. Doc Soy?
Okay, for me po, I want you to remember yung acronym po na PATS, P-A-T-H-S. Number 1, P, private parts. So we have to teach our children the proper names for their private parts. A, always covered. Yun yung mga natatakpan ng bathing suit. So sa breast, saka sa bandang ari. T, touching rule. So we have to emphasize sa ating mga anak yung my body is mine na rule. And then yung touch continuum. So safe and confusing touches. And kasama din po doon yung 3 safety steps. Say no, get away, and tell a trusted adult. H for honesty. So walang secrets dapat, especially pag may nag-break ng body safety rule or touching rule. And lastly, S, safety circle. So, kailangan merong 3 to 5 trusted adults within and outside the family na pwedeng magpuhan po ang mga bata para pag may kailangan nila ng tulong, especially if someone breaks a body safety or touching rule. So, PATS, P-A-T-H-S po. Yun lang, Doc
Pats,
Claire.
noted, Doc Soy. Thank you. So, well said, Doc Rosette and Doc Soy. Truly, this discussion has been a great start to our morning. So to all of you watching and to Doc Rosette and Doc Soy, until our next coffee, and conversations.
Thank you.
Yay.
Thank you all.
Thank you again to our resource speakers. I truly enjoyed our coffee and conversation this morning. To all our participants, thank you for joining us. For your certificate, you may scan the QR code or click the link on the chat box. I will return to this slide in a while. For inquiries about us and other pediatricians and other specialists at the Medical City, please contact the Institute of Pediatrics with this number. And if you have any concerns about your child's development or behavior, or you just want to check if their development is on the right track, you may bring them for developmental screening at the Center for Developmental Pediatrics here at the Medical City. I would also like to invite you to our upcoming webinars. On November 23, 2024, we are inviting you to our parent class on language stimulation. Our expert speech language pathologists, Teacher Kat Puruganan and Teacher Serena Tan, will guide you on how to promote your child's language development. To register, you may scan the QR code. On December 7, 2024, we are inviting you to our annual Teen Congress with the theme Breaking the Habit, Understanding and Managing Teen Addiction. Join our expert adolescent medicine specialists and adolescent psychiatrists in this important event. To register, you may scan the QR code. Again, thank you for spending your morning with us for the Institute of Pediatrics Learning Academy's Coffee and Conversations. I leave you with the link to the certificate. The link will be open until 5 p.m. today. See you in our next webinar. I am Dr. Claire Pioquinta Doble for Coffee and Conversation of the Medical City Institute of Pediatrics, your partner in pediatric healthcare. Good morning, everyone.